less appointments, a quicker time frame from that point of surgery to the point of getting a tooth back. So I think from a patient standpoint, it's not only healthier and better for them in the long term, but it's also easier for them to go from start to finish.
I take a lot of photos, intraoral photos when I'm doing the surgeries and post-op surgeries, and I show the patients. The healing, to me, what turned me on to this whole implant was right after it's placed, before I'm done suturing, the tissue already wants to close, and how beautiful the tissue looks. So if we care about inflammation, we're trying to reduce inflammation, and if your tissue can heal that minute and start the whole healing process, we know we reduced the inflammation, and now if we reduced it, you're going to heal and your whole systemic health is going to get better. Systemic, biologic, and holistic approach to see where there is any issues with the patient's systemic health, and can we relate it from the meridian charts? Can we relate it to the tooth? If we can relate it to the tooth, is it that tooth? Can it be? We can do some tests to see if it is that tooth that's bothering them, and if it is, then we can have the discussion to say, these are the next steps that you can do for this tooth, and can it help the systemic health? Possibly.
Oh, that's multiple levels. That would take a lot of time to go into detail. The highlights. The thing I love most about the SDS system is how well the tissue, soft tissue, responds around it, and how everything is above the gum tissue. So you don't have to worry about any cement seeping into the bone and the gingiva. You don't have to worry about infringing on the biologic width. You don't have to worry about a lot of these things that with other systems are a big problem. Can be a big problem.
The reality, the experience of the SDS, the patient feels very comfortable because when I can able to deliver the crown very quick. I don't need to wait for the lab 90% of the time, because I can deliver the crown or the temporary the same day or the next day.
I'd say the biggest outcome for the patients is faster treatment time, because we're able to place most implants immediately after taking the tooth out. We're able to temporize implants in most cases, especially in the anterior cosmetic zone, immediately. In the past, with other ceramic implant systems, you weren't able to achieve great primary stability with the implants. You weren't able to achieve higher torque. So oftentimes you might have had to place an Essex retainer or place a two-piece implant, which changed the patient experience. They won't go home with a tooth after having their front tooth extracted the same day. So SDS has definitely improved patient experience, where there is no downtime for the patients without going with a prosthetic. Even though going with the temporary, they're achieving a highly aesthetic results even in the temporary phase, and that has definitely been a big practice builder.
You know, I think that it just comes down to, I mean, I didn't place too many other implants, but it's just me having the confidence to offer so much more now to my patients than I otherwise would have been able to offer. I'm now able to do front tooth in the aesthetic zone, anterior immediate implants, and feel confident that I'm giving them a really superior product and result. I'm able to do external sinus lifts now through training with SDS. I'm able to offer so much more to my patients than I was, just 3 years ago.